My name is Abdulakim Akintobi. I'm a gynecologist and minimal access surgeon. I'm currently the director of training of AGES, the Association of Gynecological Endoscopic Surgeons Nigeria. Having realized the gaps in the field of minimal access surgery in the country, we took it upon ourselves to organize this training.
My name is Dr. Josiah Yakubu. I am from Barodico Teaching Hospital, Kaduna State University. I actually motivated to attend this training in minimal access surgery because now the trend is actually going towards minimal access without the need to actually do the traditional open surgery. So, and then of course the benefits for the minimal access surgery is actually enormous. You can't mention them all, and you cannot overemphasize that about them in terms of the patient and then even you, the surgeon.
Good day, ladies and gentlemen. I am Dr. Adebayo Adewale. I am the current president of the Association of Gynecological Endoscopic Surgeons of Nigeria. This training was motivated by the passion to train the next generation of minimal access surgeons in Nigeria. We have embarked on a lot of programs before. There are webinars, there are several conferences that have been held. This is the 9th year now that the association was created. However, this current training program is the second in the series of training that we have organized. We have been seeing great impacts from the training that have been organized. Starting from the last one, there are reports of the teaching hospital starting at least basic minimal invasive surgery in that particular hospital, and it's a good thing that some of those that are there in that particular environment can benefit from those surgeries without having to travel as far as Abuja and some other places.
Having realized the gaps in the field of minimal access surgery in the country, we took it upon ourselves to organize this training, and it was well received by our colleague in surgery, in gynecology. We work as a team. So not only did we train doctors, we also trained our support staff, the perioperative nurses, who will be there to take care of our instruments. They circulate for us, and they ensure that safety is also maintained in the theater. We had a total of 32 participants, 22 doctors, and 10 nurses from different parts of the country. Here in Abuja, Kaduna, Asaba, Lagos, Zaria. They all came in and participated in this training workshop.
My name is Dr. Baba. I am a senior resident in obstetrics and gynecology from National Hospital, Abuja. This training so far has been eye-opening. It spanned from theoretical knowledge to simulated sessions in the dry lab, and also ended with a live session on diagnostic hysteroscopies and laparoscopies.
I'm Dr. Onosanda Mala, a founding member of AGES. I'm the medical director, Ida Hospital, the venue of the training for basic endoscopic skills for AGES, minimal access surgery. It's a collaboration with AGES, to have this training. Most important thing is that the participants, came from far and near. We wanted them to have a good feel of what they are here for. That is hands-on experience, not just doing dry lab or working on mannequins and simulators, but having a hands-on experience. And I'm so glad that each and every participant had life experience, at the end of the training, which is something very commendable. The aim of the training was actually a sensitization training to expand or increase awareness and knowledge of minimal access surgery and to expand the scope within the nation. And I would say that yes, at the end of the day, I'm quite satisfied that the training was a huge success. And from the testimony from the participant, I'm also quite happy that they have actually attested to the fact that it was very impactful and they were able to pick the basics of minimal access surgery. This will feel like a stimulator, to pushing them to improving their skills or their passion in this front.
I'm Dr. Aisha Ahmad. I'm a fellow with the West African College of Surgeons. I'm one of the participants of the AG's training in minimal access surgery, and I was motivated to come here, though I had a lot of hands-on in my center, but I was curious to know some of the theoretical knowledge base to expand more on them, and also to have to improve my clinical skills, and in also more so now that I'm saddled with the responsibility to train my younger ones. I was motivated to come here in order to have an improved knowledge, in order to also help my junior colleagues.
I must say that the number of participants was regulated because those who actually wanted to come for this training were far more than those that we admitted at the end of the day. And the reason was deliberate. We wanted to have an impactful session. So we had to take the number of doctors and nurses that we think we can relate with one-on-one and allow them to have maximum impactful learning. And that's why we restricted the number. So for those who were disappointed that they could not come in, there's always another time. Aegis is here, and we have started this, and we believe that as time goes on, we'll be able to do more. And for the institutions that are willing to also train their members, Aegis can bring this training to any institutions and train your local doctors and nurses, okay, using your equipment, and then using your patient as well to help them acquire this skill. So as for me and my team, we were quite fulfilled. This wasn't an easy task. Organizing a training is a difficult task, and a training of this magnitude in the healthcare sector. So special thanks to our host, Dr. Ono, the CEO of DIDA, for his magnanimity, his sponsorship, and for helping us to navigate the troubled waters. And at the end of the day, the sacrifice paid off. I must also use this opportunity to appreciate Dr. Moses Fache, who was a very big sponsor of this program. At this stage, this program is not a revenue generating program. It's more or less like a corporate civic responsibility. We want to impact on our members, on our colleagues, and we want minimal access surgery to be firmly rooted in different parts of the country. And we hope to see you again when next we call on you to come for our training program. I would believe that it can only get better. Thank you.